Hi, this is Young Han, and I am doing a video for inserting an indwelling urinary catheter. So before beginning the procedure, I would go over the doctor's orders on the urinary catheter insertion for the patient, and I would gather my supplies and equipment before entering the room. So when I enter the room, I'm going to knock, and then after entering, close the door for privacy, introduce myself, and perform hand hygiene. Hi, my name is Young, and I am going to be the nurse taking care of you today. May I get your name and date of birth? And then I would check the information on their armband to make sure that it corresponds with the information that they told me. I would also use this time to go over the procedure and what to expect and why it is being done. So today we're going to insert a indwelling urinary catheter, and what that means is that we are going to insert a long thin tube into your urethra and into your bladder, and that tube is going to connect to a urinary collection bag. And the reason why the doctor ordered this is because you are having some issues with urinary retention, and this will help relieve that by allowing the urine to drain from your bladder into the collection bag. And then I would also get an assessment of their genitourinary history, particularly if they have had a catheter insertion before, as well as any allergies, particularly iodine and latex. And if they say no to the allergies, I would continue with the procedure. So first I am going to prepare my workstation by wiping down my table. And then, at this time, I would perform hand hygiene, and then don some clean gloves and provide peritoneal care for my patient. So that means I would just use warm water and a cleanser and a washcloth to clean the perineal area, and also use that as an opportunity to assess their perineal area for any redness, inflammation, lesions, or any other abnormalities or signs of contraindications for a Foley catheter insertion today. Alright, and then after I am done providing perineal care for the patient, I would remove my gloves and then perform hand hygiene again. Alright, and then I would get my Foley catheter kit ready. So I would use the bag of the Foley catheter kit as a garbage bag that I place at the foot of the bed. Oh, and before I started this, I would have also raised the bed to a comfortable level and then had my patient lay on their back in supine position with their legs apart. Alright, and so when I open my Foley catheter kit, I am going to use sterile technique and make sure to be careful to only touch the edges of the wrapping, and also have made sure to open the first flap away from me, and then be careful not to lean over the sterile field. I am going to make a note of my 1-inch border, which is no longer sterile, as well as the areas of the wrapping that is draped over the edge of the table, and those areas are also no longer considered sterile. So I'm going to very carefully remove my drape from my kit without touching any other part of that sterile field, and just put this between the legs of my patient, shiny side down, while also being careful to only touch the outer 1-inch edge to keep the rest of the drape sterile. And the reason why we put it down is to keep the area under our patient dry. And then I'm also going to use the fenestrated drape to drape over my patient. And in real life, obviously we'd have more space between the table and the patient, so I would not be leaning over my sterile field to drape my patient in real life. Alright, next I am going to don sterile gloves. And I'm going to be careful to only touch, I'm going to put on my dominant hand first, and I'm going to be careful to touch only the inside cuff of the glove while I pull it over my hand. And then with my dominant hand now sterile, I am going to put my fingers inside the cuff of the other hand and then make sure my thumb is out of the way as I slide my other non-dominant hand into the glove. Alright, now that my hands are both sterile, I can touch anything within my sterile field, so I am going to use this opportunity to arrange my catheter kit. In real life, we can, this package would be new and unopened, obviously. Alright, and so I am going to use my sterile lubricant to lubricate the tip of my catheter, and so I'm just going to pour it into the tray and then leave the catheter tip inside the lubricant. I'm also going to take my pre-filled syringe of sterile water and just screw that onto the port of the catheter. Alright, and then while maintaining a sterile field, I am going to set the box and the tray between the patient's legs on the sterile drape. Alright, and then before I insert the catheter, I am going to use the alcohol swabs to clean the labial folds on and the area around the urethra. So what I'm going to do first is I'm going to do with my non-dominant hand, spread the folds of the labia to expose the urethral opening, and then I'm going to use the first swab to clean one side of the labial folds, just from front to back. And then I'm going to use the other one to clean the other side, front to back again. And then I'm going to use the last alcohol swab to clean right down the middle, front to back one more time. Alright, and now while keeping a hold with my fingers of the labial folds, I am going to grab the catheter with a lubricated tip. By about 2 inches from the tip, and before inserting, I'm going to let the patient know that I'm about to insert the catheter into their urethra and ask them to bear down to make it a little bit easier for them. Alright, and about 2 inches in, I can start to see some urine, so I'm going to go about 2 to 3 more inches if I can, before I use the pre-filled syringe to inflate the catheter balloon. Alright, and once my finger, once the plunger is all the way down, I am going to make sure not to release the plunger again so that the water does not flow back into the plunger. So what I'm going to do is use my non-dominant hand to stabilize the port and just pull that out. And then once that is done, I am going to secure the catheter to the side of my patient's leg, either using tape or a strap. And then I'm going to hook the urinary catheter collection bag to the side of their bed using the hooks and make sure that it is below the level of their bladder. Alright, and in real life, ideally, there would be a leg to strap or tape this to. Alright, and then once the catheter is in place, I'm going to, rewind just a little bit. Before I strapped the catheter to their leg and hung the bag, I would have very gently pulled at the catheter a little bit to make sure that the balloon is inflated and in place properly, and I would know that because when I pulled it, I would feel a little bit of resistance. Alright. Now, with their catheter in place, I would provide perineal care and just wash and dry the perineal area as needed before covering the patient, placing them back in a comfortable position, and then removing the drapes and used equipment. And then I would remove the used equipment and dispose of it into the proper receptacle. And then remove my gloves and perform hand hygiene. And then once I perform hand hygiene, I would come back and document the procedure. So I would document that the patient had a indwelling urinary catheter insertion. The type of catheter was a Foley Catheter 14 French, and that they tolerated the procedure well with no complications. I would also note that the amount of water filling the balloon catheter is 10 milliliters, and that the urine coming out into the collection bag is clear and yellow, and at about 25 milliliters. I would also make sure to document on document on the bag itself the date and time that it was that the Foley catheter was inserted, as well as my initials. Alright, that concludes the video. Thank you.